Personalized alignment in knee replacement is a term which is used after the era of robotic knee replacement. This robotic knee replacement has changed the concepts of knee replacement compared to what we were doing conventionally or manually. After the advent of robotic surgery, few concepts have changed. Then comes the term called personalized alignment in total knee replacement. I am explaining in this video about the personalized alignment in simple language that it can be understood without any orthopedic background. Before we go to personalized alignment, we should know that in this particular MAKO robotic system, we will be feeding the system with the 3D images of knee of particular person we are doing surgery. Then this image of the 3D CT will be shown in front of us during the surgery. Based on that, we will be doing surgery. So with this in background, what are the things we do during surgery which certifies to be called as personalized alignment? That means personalized alignment in simplified terms means that surgery is done specifically based on the particular anatomy of that particular patient, not one size fits all approach. That means little small changes we do during surgery based on the anatomy of that particular person. That's why this is called as personalized alignment. Here let's see what we are doing. We do something called resection of the bone in order to put the implant of tibia and femur. In this particular tibial cut, first point is that in this particular tibial cut, what we do is we can increase or reduce the slope up to whatever is the native slope of the particular patient, and we can increase or reduce the tilt of this base plate, and we can increase and reduce the thickness of this resection up to 1 mm. That means whatever is the anatomy of patient, we can change the resection in coronal plane, sagittal plane, and in three-dimensional plane. We can change the implant position in up to 1 mm or up to 1 degree. You might be knowing that this bone is called femur. There is an anterior bowing, that means the front bowing. To accommodate the front bowing of this implant, we can increase the sagittal plane positioning of this implant along with the coronal plane tilting or proximalization or distalization of this implant. To summarize, we can increase the sagittal plane flexion, we can increase the rotation of this component, we can increase the thickness of this distal femur, all these values up to 1 mm or 1 degree during the surgery. Likewise, we can do same thing in the tibial component. The result of this fine tuning of the resection of the bone, how it translates into results, clinical results, is that we are interested in making this gap as much rectangular as possible when knee is kept in straight position, when knee is kept in bent position of 90-degree bending, and when we see like front when the knee is bent, this is called as flexion gap, this is called as extension gap. We are not resecting, releasing so many soft tissues, and this makes the surgery lesser invasive and more precise manner. The another feature which is important in MAKO robotic system is that there is something called haptic boundary. It will create a boundary so that whatever resection we are doing, it will not cross the boundary, so that the soft tissue damage or damage to the vital structures are absolutely nil. So based on these features, we can do surgery, something like a personalized surgery. Because we are doing fine tuning this resection, fine tuning to the extent of 1 degree, 1 mm in all these planes to make this knee more natural as much as possible. This is the concept of personalized alignment, this is the concept of functional alignment, and this is the concept of robotic surgery. Thank you.